So let's see, who do we have online? Gardner, are you with us? Gardner? All right, and Lisa Fry, Darla Bridges. Barbara.
I think so.
All right. I saw that Gardner joined us, but I don't have a picture, and I don't hear anything. All right. So tonight is our last class. We are on chapter 29 and 30. We're going to go over the answers for 28, 29, and 30, and we'll do that all together at the end. But as I mentioned last week, you should have filled out your exam form and looked on the AAPC website for dates, which I did give you some last week. So let's go over what's going to happen. A week from tonight is going to be Thursday the 26th. So by next Thursday, you are going to take the pre-exam on Evolve. And then you will email me your results from that pre-exam. Now, when you take the pre-exam, it allows you to print them. I usually just save them as a PDF on my desktop, okay? And you can attach it to an email and send it to me. When you go into the exam on Evolve, you will have to, I believe, add your access code. I believe so, if not, fine. And make sure when you log in, you enter your name and your email, just like it says. Don't leave it blank, all right, because it remembers how you logged in. So if you don't enter your name and email address each time, it's going to give you different results than what you had the way you logged in the first time. So just for instance, if you log in and you put in your name and your email, then you go in and you take the pre-exam and you log out and you go back in and you think, oh, well, I entered that already. You don't have to enter it again. Yes, you do. Because then it's going to recognize that you're signing in again for the first time. And it's going to show you have a pre-exam that hasn't been taken. Okay? So sign in using your name and your email address. The pre-exam is on the computer, just like the post-exam. It is 5 hours and 40 minutes, and I highly recommend you do it when it's quiet. You know, find 5 hours and 40 minutes and simulate just like you would a test. Now, what's different is that it's multiple choice. It is not like you have your homework here that you have to go and find the answers. All right? So what you want to do is you want to find the two most incorrect answers as quickly as possible. So it will give you a question, it will give you 4 multiple choices, And you just want to look at it and think about, okay, what doesn't fit here? So when you do this pre-test, I'm looking for what did you learn from the class? So there's no studying involved for the pre-test. You're just going to take time over the next week, figure out when you can do 5 hours and 40 minutes and take the pre-test. No using your textbooks or your workbooks, only the HCPC, the CPT, and the ICD-9. And time yourself. Get an egg timer, use the stopwatch on your phone, whatever it is. But do it uninterrupted. You can have some water, but keep in mind if you get up and use the bathroom, the time should not stop. Okay? So you're going to have to go and be back quick. So that's in 1 week. That's what you're going to do in 1 week. Once you're done taking the pre-exam and you send me your scores, you're going to start with your CPC review book. And you're going to start in Unit 1 and Unit 2 and basically get through half the book by April 2nd. So by April 2nd, I want you to take the post-exam. April 2nd, send me your test results again. And then you will finish the exam review book, and we will come together Thursday, April 9th, for a review.
At what time?
Same time, 5:30 to 8:30. Here, yep.
And that's Mount Ararat?
Yes, that's just for the review. You can come to Mount Ararat or you can go there to Gardner. Just let me know where you're going.
All right.
Then once we're done the review class, I will I'll send you the handouts so that you can start working on them before our review. Actually, I might not, because you'll have enough to do with the pre and post. But the post exam is online on Evolve as well. All right, so we'll meet back here April 9th for a review. And what that means is that anything you got wrong on your pre and post exam, you will not be able to print the pre-exam. You will not be able to print the pre-exam. When you're done the pre and post, then you will be able to review what you got wrong. Only then, only after you take the pre and post, will you be able to review what you got wrong. So you can bring those exercises or those numbers with you. You don't have to print out the whole 150 question report, okay? Just bring the numbers of the ones you got wrong, okay? All right, so that's April 9th. We'll meet here at 5:30. And then what I try to do is within the next few weeks, after that, I try to plan the mock exam, and usually on a Saturday. And basically I have to go where I get space. So I've started putting the feelers out now to see where I can get room. Is there any Saturday that doesn't for those of you who are here with me? Lisa?
Did you say my name?
Yes, Lisa. Yes.
You went out. What'd you say?
Is there any Saturday that does not work for you?
Oh no, I'm all up for anything.
Angel?
It's fine with me. Will it be the same time, the 5:30 to 8:30, or a different time on the Saturday?
No, it's going to be during the day because it's going to be the 5-hour and 40-minute exam final.
Okay. So days. Yeah.
So Thursday the 9th will be the 5:30 to 8:30.
Mm-hmm.
And then following that is when we will plan the mock exam.
The exam I put down for May 16th, is that pretty much what everybody did
I don't know.
in Bangor?
Okay, so just to reiterate, tonight is the last class. Within 1 week from tonight, you will take the pre-exam. No studying, just take the pre-exam. Send me your results. Within 2 weeks, you will finish half of the exam review book, take the post-exam on Evolve, send me your results. After the post-exam, you will finish the rest of the CPC exam review book. And then we will come back here and meet on the 9th for a review. And this is where we will go over tips and tricks and learn some other things, okay? And then after that meeting, we will have a mock exam scheduled within the following weeks. And that mock exam will be 5 hours and 40 minutes. You will bring your CPC exam review book because it's going to be out of the back of that book. And I will remind you on the 9th what you need to bring.
And this was the book that we were supposed to receive, Dory?
Yes, and that you should be getting that. I emailed Amy to let her know. All right, any questions? Okay, so I've got it set here. We'll be back here on April 9th. All right, so tonight, chapter 29. Page 798 in your textbook. Page 449 in your CPT book. All right. So, Chapter 29 is about pathology and laboratory. And you will find that in the Path and Lab, the subsections are things as organ or disease-oriented panels, drug testing, therapeutic drug assays, evocative and suppression testing, consultations, urinalysis, chemistry, immunology, the list goes on, but you will see that they are in big green letters throughout your Path and Lab. And those are what is called your subsections. Coding for Path and Lab are for test only. When you have a specimen collection, that is coded separately. So for example, a venous blood draw would be reported 36415. And that's usually found in the surgery section. The Medicare fee schedule each year will identify those lab tests that are associated with a physician component. You will also have facility indicators. So allow additional tests without physician written order. The facility indicators allow for this. So a urinalysis positive for bacteria, they build in the indicator for culture. Okay. What I want to caution you about with Path and Lab is that you usually report the second or subsequent tests without the modifier 51. And the modifier 51 is for multiple procedures. Rather, in Path and Lab, what you're going to do is report it with a ×2 or a ×3. For your codes 80047 through 80076, these are your organ or disease-oriented panels. These are the group of tests that are often ordered together. So for example, a basic metabolic panel or a general health panel or an electrolyte panel. Some rules regarding panels. All of the tests must have been conducted and be medically necessary. Do not use a modifier 52 for a reduced service. If there are additional tests that are over those in the panel, you would report them separately. And if for some reason all the tests in the panel are not performed, you would actually list each test separately. You would not use the panel code. So the panel code is made up specifically for doing that particular panel, not to pick and choose what you want in the panel. If you're going to start picking what you want out of the panel, then you're going to list those separately. And the panels are usually based on a problem-oriented scope. The drug testing, codes 80100 through 80104, these list the drug screenings, the drug confirmations, and the tissue prep services. It helps to identify the presence or absence of a drug. This is where you see the qualitative analysis. The confirmation is usually of a double check resulting of a positive drug test. So if you look at 80102, look at that for me, Emily, and read it, please. 80102.
Eight 0102, you said?
Yes. Yes.
Sorry. I can't find it. I don't know why. I see that it's been deleted, it says.
And what replaces it?
I think no,
It doesn't say.
unless I'm not reading it right. I just saw it like right above, right on the pathology, on that recorded page, right there in the green space. That's the 80102 of the deleted, the other ones. To report reported and/or definitive drug testing C.
It has been deleted.
So to report those drug testings, then what it tells you to do is look at 80300, 80301, 80302. So if we go to that,
So that, okay.
yep, 80302 is for your drug screen presumptive single drug class from drug class list B by immunoassay and so on. So it's important to pay attention to those parenthetical notes, the green notes, whatever they have in there.
I thought the pages were sticking together.
Right,
I couldn't find it,
right.
sorry.
But that is when you're confirming a drug test. You're confirming a drug test because you're double checking positive results. Chromatography, there we go, is a procedure in which multiple drugs are identified. Some of the machines will identify all the drugs that are present in actually one procedure. And others require 2 or more procedures to identify 2 or more drugs. We would code the number of the procedures, not the number of drugs that were tested for. So if we did 2 procedures to identify 3 drugs, we're actually going to use the code times 2. Okay? If we're doing 1 procedure to identify 3 drugs, It would just be the one code. So again, it's about the procedure, the number of procedures, not the number of drugs. Now, the drug testing does not identify the amount of the drug present, only the presence or absence. So not the amount of, but the presence or absence. And your quantitative analysis tests for a specific amount of analyte present. This is what the drug testing will also show, is the quantitative analysis for a specific amount. On page 467 in your CPT book, the therapeutic drug assays. These report the presence and amount or absence of a substance. So when we're reporting the amount, we are reporting the quantitative. Amount equals quantitative. The material examined can be from any source. Your drugs are listed by generic names. So amitriptyline, generic name for a brand name would be Elavil. You would use the PDR to code for drug testing. Your measure peaks, these are after the drugs are given at intervals, and troughs, so before the drug is given on the next dose. This is used to monitor the therapeutic drug for medication adjustment. You'll see on 468, 469, 470, they give you definitions and acronyms for conversion listing. Over on page 478, you have the evocative and suppression testing. The measures are stimulating or suppressing agents. Evocative, it means calling forth a response. In this section, the code report would only use a TC modifier. Some of the additional services to report here would be supplies and or drugs that are used in testing, such as the 99070 and or the HCPCS codes. Your E&Ms would be for physician monitoring of testing. Consultations, clinical pathology. This would be at the request of the physician. This is where additional information about a specimen is needed. The consultant would prepare a written report. They would look at some levels, either limited or comprehensive. Limited would be without review of the medical record. Comprehensive would be with review of the medical record. You would see more consultation codes. Surgical pathology, you would see 88321 through 88334. These are usually used when either the pathologist reviews the slides and material or provides consultation during surgery. So surgical pathology, you would be reporting on a specimen, a block, a section, or a cytologic exam. Some terminology to be familiar with. Specimen, what is a specimen? It's a sample of tissue of the suspected area. Block is a frozen piece of a specimen. Section is the slice of frozen block. Urinalysis, the testing on urine. Some of the methods would be tablet, a reagent, or a dipstick. Some reasons for the testing would be pregnancy. And some constituents would be tested for their bilirubin or glucose. The equipment that is used during urinalysis is an automated or non-automated, usually with or without a microscope, and you would do it based on the number of tests performed. Chemistry. On page 506 in the CPT book, chemistry. The chemistry is on specific tests on bodily substances, such as urine, blood, breath, and feces. Most of your chemistry tests are quantitative, meaning the specific amount, unless specified qualitative. So quantitative is amount. Your samples from the different sources would be reported separately. So if it was a blood sample, that would be reported separate than a feces sample. And samples taken at different times of the day would be reported separately. So if they come in the morning and take blood, and they come in the evening and take blood, two separate reports, procedure codes. Hematology and coagulation. Page 518 in your CPT book. This is where the laboratory procedures are done on blood. So, for example, a CBC is a complete blood count. A WBC is a white blood count. The codes are going to be divided based on the method of the blood draw and the test being conducted. Immunology on the next page, 520. Immunology helps to identify the immune system conditions caused by antibodies and antigens. So, for example, hepatitis C antibody screening or tissue typing. Tissue typing, they might do it for compatibility testing on tissue to match a donor to a recipient and to measure and monitor the cytotoxic reactions. 526, transfusion medicine. 526 in your CPD book. Transfusion medicine. These are your blood bank codes. The tests are performed on blood or blood products. It does not identify the supply of blood, but the collection, the processing, and the typing. So your transfusion medicine are your blood bank codes. This is where the tests are performed on the blood or the blood products. It does not identify the supply of blood, but rather the collection, the processing, and the typing. Your microbiology on page 527 in your CPT book. This is all about the study of microorganisms. This is where they identify those organisms and the sensitivities of those organisms to antibiotics. What I want to caution you about here is that a lot of these code descriptions are similar to those in immunology. The difference here is what is the technique that is used. So the difference between microbiology and immunology is the technique that is used. Over on page 534, the anatomic pathology. This is for those post-mortem examinations. It reports only the physician service. The codes are divided on the extent of the exam and type of exam, gross versus gross and microscope. So for example, a gross exam without central nervous system, or a gross and microscope without central nervous system. And you'll see right underneath the post-mortem exams, you only have, a few dozen codes there, not even. So you don't have a lot to choose from. It's either or, with or without. The cytopathology, what does this do for us? It helps to identify the cellular changes. You'll see here common laboratory procedures such as the Pap smear. These codes are divided on the type of procedure and the technique that is used. The cytogenic studies, page 536. This is the branch of genetics concerned with the cellular abnormalities and pathologic conditions, such as the chromosomes. Surgical pathology on 537, the evaluation of specimens to determine the disease pathology. This is where all the tissue removed during the procedure undergoes pathology exam. For the surgical pathology, the operative report usually is coded after the pathology report is received. Because your pathology reports are usually coded with your OR. So if you have an OR report, you should have a pathology report. and vice versa. In the pathology, you're going to see a unit of measure, which is the specimen. So if they tell you that they removed 2 anus tags and each were examined, it is going to be the procedure code times 2. If it's just 1 tag examined in 2 different areas, it's just going to be 1 procedure code. Okay? The types of pathological exams. We have the microscopic, which is with the microscope. We have the gross, which is without microscope. So when you hear the word gross, what is the first thing that comes to mind? Okay? So if you look up 88300, what is 88300?
Surgical pathology, gross examination.
Okay. So just the fact that it's surgical pathology. How I think about it is when I hear the word gross, it means icky and disgusting. Like I'm not going to be able to use a microscope. So that's what I remember when I think of gross. So I hear the word gross and I know it's not going to be a microscope. But you might have others where it's gross and microscopic. And that means that they probably got enough of a little grossness to put under the microscope. However you can come up with thinking about it, okay? But that's how it made sense to me. So there are 6 levels of surgical pathology. And you'll see on page 538 and 539 in your CPT book. It is based on the specimen that is examined. So is it the breast, is it the prostate, or is it the lung? And then what's the reason for the evaluation? So specimen and reason. So radiological procedure for suspected carcinoma. Then you'll notice that those levels are divided on the complexity of the exam. So for example, a colon biopsy, pretty straightforward, right? Pretty simple. But then we have a colon segmental resection other than for a tumor. Does that sound a little more intense? All right, how about a total resection of a colon? So listen to what it's saying, and you'll be able to determine what level it is. So level 1. Level 1 would be where the specimen can be diagnosed without a microscope. Level 2. Usually a gross and microscopic exam is performed. Levels 3, 4, 5, and 6 includes the gross and microscopic exam and additional physician work, which increases the difficulty. These are also based on the method of or the need for removal. So what's the method of removal? Or do we need to remove it? And believe it or not, the same anatomical site can be listed in each level. So it's just knowing what are they doing. What might not be included in these codes for Path and Lab are additional service codes. You will see that additional service codes are not included in some of them. So for example, a special stain, 88312, that would be reported separately. So any type of additional service would be reported separately. And you'll see that your additional service codes are 88311 through 88399. Okay?
Would it start with
88311. Should be right over on. Over on page 540, maybe. 88311 through 88399. These are not included in the 88300 through the 88309. So you want to make sure that you're reporting additional codes separately. And that is it for Path and Lab. Any questions? All right, how many like the medicine section? No one, huh? All right. So the medicine section, we'll move right into chapter 30. We'll go over all the answers afterwards. As I mentioned, we're not going to go over 31 because it's inpatient coding, and inpatient coding is not on the national exam. If you wish to do 31, go right ahead. It's not going to hurt, but you don't have to for the class. So for the medicine section, we start at page 550? Or is it 560?
It's the guidelines are on 548.
550. And guidelines are before that. Your textbook is 815. All right, so with the medicine section, this is where you're going to find all of those other procedure codes that they didn't talk about in all of the other systems. This is where your diagnostic and therapeutic procedures are. This is where most of the procedures are non-invasive, where they are not entering the body. But there will be some invasive procedures, such as a percutaneous transluminal coronary thrombectomy. As with everything else, there are numerous notes throughout the chapter. So read your notes. The subsections. You will see a wide variety of services. We start out with immune globulins, serum, or recombinant products, and I think we end up at the end with phone calls. Believe it or not. Special reports and phone calls. there's going to be a lot of specialized testing as well, such as audiology or biofeedback. The first subsection is the immunizations. This is probably the one that is most often used. There are two types of immunizations. We have active and passive. The correct coding includes the supply that's injected, as well as the administration of the injection. If it is an active immunization, it is for a bacteria or virus. And the bacteria that cause the disease made non-toxic is called a toxoid. This is what is injected to build the immunity. A small dose active virus being injected is called a vaccine. And this is injected to build immunity also, such as the polio virus. A passive immunization does not cause an immune response. Excuse me. It will contain the antibodies against certain diseases, which are the immune globulins. Your immune globulins, they identify the immune globulin product, such as botulism antitoxin. Okay? You would report that administration separately. You'll notice that with the immune globulin codes, they are divided by type, method, and dose. Let me repeat that. Your immune globulins are divided by type, method, and dose. So, is it a rabies or a hepatitis B? Is it intramuscular, intravenous, or subcutaneous? Or is it a full dose or a mini dose? The immunization administration for these vaccines and toxoids is the performing of the injection. So the administration is the performing of the injection of the specific substance. And you would report it with the substance that is given. And you'll see that there aren't that many codes for administration. Also pay attention to the age. All right, what age are they? Are they all under a certain age or over a certain age? Is it percutaneous, intradermal, subcutaneous, or intramuscular? And then we have an oral or an intranasal as well. So some of the methods to take into consideration will be intradermal, subcutaneous, intramuscular, intranasal, and oral. And those should be key words within the codes. When you're reporting the administration of each dose, whether or not it is a single or combination, let's say, for example, the patient is over 8 years old and they receive 3 separate administrations. One is tetanus, one is rubella, and one is diphtheria. The tetanus would be first. The rubella and the diphtheria would actually be add-on codes. If you look in your book, you should see plus signs. Those are add-on codes. Or, depending on the payer, okay, because remember what I said, when you get out into the real world, it's going to depend on what the payer wants. You would use the tetanus code first, and then the 90472 times 2 to equal the rubella and the diphtheria. Just depends, how does the payer want it? Vaccines and toxoids, you will see that there are many codes here that are age specific. So I would go through this section and highlight the age, so that age sticks out for you. You will code for products for single diseases and codes for combination of diseases. Be careful though, because diphtheria has many combination codes. It's just a matter of what is it combined with. Is it tetanus and pertussis? What else is in there, okay? Also, some of your vaccines are given on a schedule. So 90634 is a 2-dose hepatitis A vaccine. So the first dose is on the first visit, the second dose on the second visit, and you would use 90634 for each visit, even though it's on a schedule, okay? What I would like you to remember with these codes is to not assign modifier 51, okay? Rather, depending on the payer, list each code multiple times or use the times symbol and indicate the number. Sorry. So again, modifier 51 should not be reported for the vaccines and toxoids when performed with the administration codes. And your administration codes are the 90460 through 90474. Some important reporting rules to keep in mind here. If the vaccination is administered during the office visit, it is not going to be related to the E&M. You would report first the E&M service with the modifier 25, and then you would add the vaccine and the administration. But also it depends on the local carrier. So the office visit for the vaccine only, you would only code the vaccine, not the E&M. And again, what does your local carrier want? Your routine vaccinations, such as the influenza, code the administration. Bear in mind that your Medicare patients, you will find the codes in the HCPCS book for those. So in the CPT book, it would be 90471 or 90472. But in your HCPCS book, if it was a Medicare patient, it would be G0008. So make yourself a note next to the 90471 and the 90472 that says G0008 for Medicare.
Can you say that again, please?
Next to code 90471 and 90472, make a note to use G0008 for Medicare patients. And again, you're going to find that code in your HCPC book. Okay? The actual substance would be 90657 or 90658. So you're coding the administration, then the substance. For pneumococcal, the administration codes again are the 90471 or the 90472. But the substance for the vaccine is 90732. Your psychiatry codes. Page 555. Your psychiatry treatment at the same time as an E&M service, you would report one code for the therapy with the E&M. For example, 90833. That is your psychotherapy and the E&M code. Time ends up being the major billing factor here. Your codes are divided on time. The medical record indicates session time. When you are selecting the psychotherapy codes, you want to ask yourself these three things. And you don't need to write these down because it should be right in the psychiatry notes. How much face-to-face time is spent with the patient? Does your documentation support an E&M code in addition to the psychotherapy? And if you are rendering psychotherapy, is the approximate time of the psychotherapy noted in the medical record? And honestly, those are the three questions you should ask yourself any time you do an E&M. What's the face-to-face time? Does the documentation support it? And is the approximate time noted in the medical record? All right, so face-to-face, documentation, and time. Those are the three things you need to know. Many of your services will be provided in a partial hospital setting where the patients are in the hospital during the day and they return to home for the evenings and the weekends. The interactive psychotherapy is typically furnished to children. This is where they use play equipment, physical aids, nonverbal communications, or other mechanisms of communication. Biofeedback on 560. This is used to help patients gain control over the body processes, such as high blood pressure or chronic pain. The Medicare Coverage Issues Manual 35-27 actually restricts the use of biofeedback, which means Medicare won't cover it. A patient can be trained in biofeedback to use on their own. The services are often part of psychophysiologic mind-body therapy. Dialysis. What does dialysis do? Dialysis cleanses the blood. When we have a temporary, it's a non-ESRD. A permanent is an ESRD. An ESRD is end-stage renal disease. So we have a temporary cleansing of the blood and a permanent cleansing of the blood. There are actually two parts that we report with the end-stage renal disease services, dialysis services. We report the physician service and the hemodialysis procedure. Your end-stage renal disease services will include the establishment of the dialysizing cycle, dialysizing cycle. It will include the physician services, the E&M outpatient dialysis visits, and the patient management during dialysis. It's usually reported for the month, 90951 through 90966 are the codes we would use. If it is less than a full month, you would code per day using codes 90967 through 90970. And these codes are going to be divided on the age and the number of visits. The hemodialysis service is the procedure used for end-stage renal disease and non-end-stage renal disease. Again, it is billed per day for your inpatients who are receiving these services. It will include all of the physician E&M services that are related to the procedure. And you would use the modifier 25 if the E&M service is provided. Your miscellaneous dialysis procedures, these will describe other dialysis procedures. The miscellaneous dialysis procedures will describe other dialysis procedures. For example, a peritoneal dialysis in which the toxins are passively absorbed into the dialysis fluid. And I think they have a picture in your book about peritoneal dialysis. Again, these services are billed on a per day basis for inpatient patients. So let's see if they have a picture in your textbook. I think page
826.
5, yeah, 826. And patients can actually receive training in self-dialysis. And if that was the case, you have two codes that you would use for that, and they're right there. 90989 or 90993. And the codes would be divided by complete or partial training program. Gastroenterology. Gastroenterology are for test and treatment of the esophagus the stomach, and intestine. These codes are usually reported with E&M or consultation service code. And you will see a lot of bundled services here. Ophthalmology. Ophthalmology also contains E&M codes. These are not the E&M codes from the front of the CPT book. They are their own new and established patient E&M codes. So if you're looking for ophthalmology E&M codes, this is where you want to be looking. Most of your codes in this section are for bilateral services. If it is only for one eye, use modifier 52 for reduced service. Make sure you read the definitions of intermediate and comprehensive services in your CPT book. And it goes on to list what is intermediate and what is intermediate and comprehensive. So it's really a short section, but this is where you're going to get your codes for new and established exams. Then we move on to the special otolaryngologic services. These are for special evaluations of the audiologic system. They go beyond those usually provided in the evaluation. They may be reported in addition to basic audiologic service. Some special services. You might have special treatments and diagnostic services. You might see a nasal function test or an audiometric test. All of the hearing tests are bilateral unless indicating one ear in the description. If you are doing just one ear, you would use modifier 52 for those reduced services. The coronary therapeutic services and procedures.
Doreen,
Yes.
I'm gonna have to go. I'm not feeling well at all. I've
Okay.
tried, I can't do it. If you could send me the lecture, I'd appreciate it.
Okay. I hope you feel better.
All right, thank you.
You're welcome. All right. Coronary therapeutic services and procedures. Will fall underneath cardiovascular, therapeutic procedures, and other procedures. If you look on page 574, you'll see coronary therapeutic services and procedures. You've got a whole bunch of notes to look at there. This is the PTCA. This is where they're accessing through the femoral or brachial artery They use a catheter with a balloon tip that's threaded up to the heart. The balloon is expanded and widens the vessel. If an angioplasty and an atherectomy are performed, during the same session, only the atherectomy is billed. Because again, we're coding to the furthest extent. Okay? Cardiography on page 577. Implantable and wearable cardiac device evaluations. And then echocardiography, we reviewed that in chapter 21. Your cardiac catheterizations. Over on page, 586? Cardiac catheterizations on page 586 in your CPT book. This is a diagnostic medical procedure. There are 3 components included in most of your cardiac cath codes: the catheterization, the injection, and the imaging. So for your congenital cardiac cath codes, you do not include the injection or the imaging. For your non-invasive vascular diagnostic studies, these vascular codes are for procedures on the non-coronary veins and arteries. The non-invasive vascular diagnostic studies would include the patient care, the supervision and interpretation, and the copy of the results. Pulmonary on page 602. This is for your ventilation management therapies and diagnostic tests. It includes the procedure and interpretation of test results. You would additionally report E&M services separately. Your ventilator management codes are further divided by place of service. So is it in the hospital? Is it in the office? Is it in the home? The facility is usually billed per day, and the home is billed by time once per month. Your allergy and clinical immunology on 605. This is divided into 3 subheadings: allergy testing, ingestion challenge testing, and allergen immunotherapy. The allergy testing consists of performance, evaluation, and interpretation of the allergens. The ingestion challenge is the test for sensitivity to food, drugs, and other substances. The immunotherapy is indicated for patients with allergic rhinitis due to seasonal pollinosis that's caused by the trees, grasses, and weeds. Under the allergy testing, we have sensitivity testing that uses various types of tests. So for example, you might see percutaneous, intracutaneous, or inhalation. And what they're doing is they're testing using numerous substances. They might use extracts or venoms and biologics in foods. The type and the number of tests is based on the physician's judgment of how they, when they do their examination and consult with you. and your medical record will indicate the number of tests, the type of test, and the method of testing. The ingestion challenge testing is for sensitivity to food, drugs, and other substances. So pay attention to the codes and the time that they report. Your allergen immunotherapy. These codes are divided into 3 types of services: injection only, prescription and injection, and provision antigen substance only. Your codes 95115 and 95117 are payable in an office setting. You'll see also underneath the allergen immunotherapy, the physician service is bundled into the immunotherapy codes. So if you do have a separate E&M service being provided, report it separately with a modifier 25. The neurology and neuromuscular procedures, 95803 through 96020, contains the codes to report your tests, such as your sleep testing, your muscle and range of motion testing, your electroencephalography, the neurostimulator procedures, and your functional brain mapping. You'll see a lot of bundled services here as well, and they're usually provided in addition to the E&M service, and these are often consultative services. Your central nervous system, CNS, has assessments and tests underneath it. Over on page 619 in your CPT book, Central Nervous System, this is where you will find the psychological tests, the speech and language assessments, your developmental progress assessments, and the thinking and reasoning exams. These codes are based on a per hour basis, except for the basic developmental testing. And you also find under these codes, it includes the written report of the results. Hydration codes. Page 622, hydration codes. For infusion, the therapeutic procedure to introduce fluid into the body. So let's say, for example, we want to get fluid into the vein for patient rehydration. We're going to look at codes 96360 and 96361. These codes represent the infusion service and the prepackaged fluid and electrolytes. You're not going to have 2 separate codes. If it is other than the prepackaged, you would report it separately. The hydration, therapeutic infusions, and IV pushes, only 1 initial service per encounter. If the patient presents for hydration, that's the initial service. If they have drug therapy while they're being hydrated, the drug therapy is subsequent, so you would report it with an add-on code. So let's say, for example, a person is there for 3 hours hydration with an antiemetic by IV push for 15 minutes. So they're getting the hydration, which is 1 hour, 96360. Then they're, for the second and third hour, 96361 times 2. And the antiemetic IV push, 96375. Your therapeutic, prophylactic, and diagnostic injections. These are on page 623. These are the types of drug administration. So is it therapeutic, prophylactic, or diagnostic? Then you're going to find that these codes are divided by administration method. Is it subcutaneous, intramuscular, IV push, intraarterial, intravenous push? Be aware that a push takes 15 minutes or less. Anything over 15 minutes is an infusion. And with these codes, you would report the substance administered with a J code. On 625, the injection, an intravenous infusion, chemotherapy administration. These codes represent only the preparation and administration of the chemotherapy. If you have a separate E&M, you would report that with a 25 modifier. Some of these chemicals can be administered or injected into the lesion, the vein, the tissue, the muscle, the artery, the cavity, the nerve. Intravenously, when they inject the chemicals, there are two methods of delivery: IV pushing quickly or IV infusion. So one is 15 minutes or less, or one is 15 minutes or more. The chemotherapy administration codes cover only when the drug is being used and is an anti-neoplastic and diagnosis is cancer. Your codes are often divided on time of infusion and injection procedure. So let's say 96413, chemotherapy administration, intravenous infusion up to 1 hour, single or initial subsequent substance and drug. When there are multiple drugs that are given by different routes of administration, there will be a separate fee that will be paid for each route of administration. Your chemical agent or the substance will be reported separately. When you have special supplies, such as the needles, they would be reported using the 99070 or the appropriate HCPCS code. Any intraarterial catheter placement would be reported using code 36640. Injections with chemotherapy, report those separately. Any analgesic or antiemetic for vomiting. And people who end up with vomiting might have it before or after the chemotherapy. And you want to report both the administration and the J code when you're using something for vomiting. Your photodynamic therapy on page 626. This is used in addition to bronchoscopy or gastrointestinal codes. It is an injected agent that remains in the cancerous cells longer than normal. After the agent dissipates from the normal cells, the lesion is exposed to laser light The agent will absorb the light, which then photosensitizes the agent, producing oxygen, and the cancer cells are destroyed. Special dermatological procedures. These are usually specialized procedures that are provided on consultation basis. Treatment of skin conditions. Actinotherapy is using ultraviolet light. Photochemotherapy is with light-sensitive chemicals and light rays. And then we have physical medicine and rehab. This is used by physicians and therapists to report services for a variety of treatments. Traction, electrical stimulation, which is used to help heal fractures, therapeutic exercise, patient training, gait training, functional activities. These codes often have time components, and they're divided on the type of therapy. Is it physical or occupational? And your modalities are divided by supervised or constant attendance. Active wound care on page 629. Active wound care. This is debridement. Non-selective healthy tissue being removed along with necrotic tissue, or removal of necrotic tissue without anesthesia. Negative pressure wound therapy is a controlled application of subatmospheric pressure to the wound. Each of these codes are for ongoing care reported on a per session basis. With this type of management, the documentation of the debridement being performed, the level of the tissue being debrided, and the method must be documented. You want to document the size and the character of the wound before and after the debridement. You want to document a treatment plan and patient education, and have direct one-on-one patient contact. Osteopathic and chiropractic services on page 621. These are both inpatient and outpatient settings. Your physician services are bundled into the codes, and the codes are divided by number of body regions involved. Acupuncture is needles. You can see there's only 2 codes there, and one is an add-on code. I'm sorry, there's 4 codes and 2 are add-ons. Acupuncture, and it's not usually a covered service by insurance. Most people have to pay out of pocket. Turn the page to telephone and online services and special report procedures and reports. These are your non-face-to-face, non-physician services where you report telephone and online E&M services by non-physicians. This is the handling and conveyance of laboratory specimens, post-operative follow-up visits that are included in surgical package. So I want you to make sure you tab this page, the 99024. Of all the codes in this section, this is one of the most used codes for surgery. For a person who has had surgery, 99024 is one of the most used codes because it is a follow-up code. It is a post-op follow-up code. So if you go to the podiatrist and you have a surgery, whether it's in office or day surgery, this is a post-op code that you would use. I can guarantee it that you have this code as one of the things on your exam. So know where to find it. Office visits after posted hours or in locations other than the office, such as a 24-hour facility. And you will notice that Medicare bundles most of the special service procedures. Special services, procedures, and reports are going to be those supplies and materials, 99070. Hospital mandated on-call services, 99026, 99027. Your medication therapy management services will report the pharmacist services in medication management. And that's it. That takes us through. Your category 2 codes and your category 3 codes, I told you, tab those sections so that you know that, one ends with a T and one ends with an F, because you will probably have one on the exam where you're like, where do I find that code again? I know she told me about it. Guess what? That's where. If it ends with an F or a T, you know to find it in your category 1 or your category 2. All right, let's take a quick 5 minutes and we'll come back and go over the answers. Is everyone back? Gardner, are you back? Gardner, are you back? All right then. Textbook. We'll start with chapter 28. All right. Chapter 28 in the textbook, theory. Number 1, radiology. Number 2, diagnostic ultrasound or radiation oncology. Number 3, separate procedure. 4, 100. 5, modifier 26. 6, supervision and interpretation. 7, diagnostic ultrasound or echography. 8, type. 9, physics. 10, dosimetry. 11, energy. 12, mega electron volt. 13, 5. 14, tracer. 15, median. 16, horizontal or transverse. And 17, frontal. Practical, 18, 99212, 71020, 99244, 71250, modifier 26, and 31628. 19, 99202, 70134, 69433, with diagnosis of 388.70. 20, 99205, with diagnosis of 782.3. Now, you did not need to be doing the ICD-10 codes in any of these. 21A, 75801, with diagnoses 729.81 and V10.3. 21B, 38790, with diagnoses 729.81 and V10.3. Chapter 29, textbook, theory and practical. Number 1, test. 2, indicators. 3, organ or disease-oriented or panel. 4, no. 5, yes. 6, practical. 85004 and 85032. Number 7, 88034. Number 8, 880, number 8 is 88302. Number 9, 88300. Number 10, 84181. 11, 84597. 12, 82101. 13, 82930 times 3. 14, 83003. 15, 83525. 16, 83721. 17, 85032. 18, 85060. 19, 85730. 20, 85652 with diagnoses 780.60 and 729.81. 21, 85345. 22, 85280 with diagnosis 627.0. 23, 86910. 24, 87086. Diagnosis 788.1. 25, 87197. Diagnoses 729.5 and 780.60. 26, 88007. 27, 80162. 80202 with diagnosis 427.81. 28, 88329. Chapter 30 textbook. Number 1, therapeutic. 2, you should have intravenous, intramuscular, subcutaneous. 3, hemodialysis. 4, peritoneal. 5, tonometry. 6, analmoscope. 7, otolaryngology. 8, cardiovascular. 9 is duplex scan. 10 is Doppler. 11 is pulmonary. 12, method of tests. 13, types of tests. And 14, special services, procedures, and reports. All right, Chapter 30, practical. Number 15, you should have 90702 and 90460 and 90461. Diagnoses V06.5 and V65.49. 16, 90703, 90471. Diagnosis V03.7. 17, 99201, modifier 25. Next procedure code 90700, 90712, 90471, 90474. Diagnosis 465.9 and V04.0. 18, 90658, 90732 with G0008 and G0009. Diagnosis V06.6. 19, 95115. Diagnosis 477.0. 20, 97761 times 2 and diagnosis 755.25. 21, 94070, 99070 with 786.05. 22, 92511 with 784.7. 23, 90960 with 585.6. What did I say 23 was?
90960.
Okay. And 24, 92002 with 242.00, 374.30, 372.73, 366.16, and V58.65. Let's go to our workbooks. Start with chapter 28. Any paper?
No, okay. I got all the work that's done.
Good.
Maybe not the textbook.
Good. All right, chapter 28. Theory. And I'm not going to read the numbers, I'm just going to read down through. Starting with 1, C, 2, E, B, F, A, D, B, E, F, C, A, 12 is D, E, D, I, B, H, A, J, G, C, F. 23, 78499. 24, 92974. 25, modifier 26. And 26 is modifier TC. 27, 75705. 28 70030, 29 70130, 71100, 70542, 72128, 33 73510, 73110, 76098, sorry, 36 99213 with 70460, 37 99219, 70450, 76516, 77261, 77402, 77427. Did you get them all?
Yeah.
Good job.
That one took me a while.
I did.
I remember doing that.
38 99242, 70492, 76604, 71550, and 33020. 40 73600. The next one 73092, 75741, 77002, 44 77011, 76872, 46 72110, 47 72240, 48 77057, 70140, 50 70328, 51 74010, 52 74340, 53 75870, diagnosis 325, 54 76390 with 225.2, 55 75945 with diagnosis 440.1, and 56 75820 with 585.6 and V45.11. For the reports, for number 58, report 46, you should have 76819 modifier 26 with a diagnosis of 642.93. And we did report 60 in class. You should have 70544 modifier 26 with 378.52. And then for report 50, we had 73620-26-LT or 73620 modifier 26 with a diagnosis of 729.5. 64, we had a 78582 modifier 26 with a diagnosis of 786.05. All right. One moment.
Could you repeat 62?
I can. I thought you had left me, Angel. You were too quiet. 73620-26-LT or 73620-26 with a diagnosis of 729.5.
I feel like we need a little bit faster.
Okay to move on to 29? All right. Number 1, surgery. 2, presence. 3, presence, amount, or amount, presence, in that order, either one. 4, physician supplied agent, or supplied agent, or agent. 5, section. 6 is the number 6, and 7 is 1. Eight, practical. 82550, 82553, 84484, with a diagnosis of 410.41.
I
9.
didn't understand how they did number 8.
All right, let's take a look at it. All right, how did you come up with the CPK total, Emily?
I don't know how I did the CPK total. That one actually, I
Okay.
was just thinking about that one.
All right, so if we look under the book and we look under CPK,
In the back.
yep,
CPK.
I think these two are the ones that I was trying to Google like the little names and
Numbers.
stuff. I was so thrown off.
yeah. Well, what's nice here is that they tell you what they're looking for. So CPK total for me tells me it's the total of the blood. So I'm just going to look up CPK blood.
82550.
Yep. You found it before I did, so.
And there's a total.
And then you just go on to find the creatinine, the troponin.
And would it come right under the initial CKMB also, or as one, or?
Well, let's check it out.
Let's see, CKB. CKMB.
No, you'd have to go under creatinine.
Creatinine, okay.
Yeah. So creatinine, blood, clearance, other source, and they tell you creatinine kinase total 82550. So if we go to just plain creatinine,
Yep. Blood, and then it has 82565.
well,
Of the
if you look
creatinine
right at
one?
creatinine itself, you have a range of codes 82553 to 82554.
Okay.
So I would, because we already used 82550 as the first code, I would look at the creatinine code range first and see if that's where I should start.
825. And the 82565 is the creatinine blood.
Nope, I would use actually creatine. Sorry, creatine. It's creatine, not creatinine.
Yeah, okay.
I misread it. What?
Creatine?
It's 82553. Yes. I misread that. So,
Sorry.
sorry. But we all did.
Yeah. And it said MB fraction only under that? 82553. CPK. CKMB. Yes, it would be the creatine and then the MB added to it.
Right.
Okay. So it's the creatinine and then, okay, 82553. Then we got tropin.
Now, what you might want to write next to 82553 is the initials CKMB.
Okay, 844.
Find it?
Yep,
Okay.
84484.
Yep. And then the diagnosis will be 41041. Did you get 9? Did you do 9?
No, not yet. Let's see. Bun. Eight, 4, 5, 3.
Okay, well, the first one for number 9 is 84520.
Uh-huh.
I have that, but I don't understand. I don't know why.
I found it under the fun.
So what you want to put next to 84540 is bun. Because isn't it bilirubin, urea, nitrogen, or something like that?
Yeah, blood, urea, nitrogen.
Yeah.
That was why I was thinking so.
Yeah. So you just put yourself a note by it. The 84520.
And I had a question. In the back, it had the 84520, but they have the semi-quantitative, and then it has the EG region grip test. Why wouldn't it be that one?
Didn't they
How
give
would
you?
you differ the difference? It just says bun in our book.
Right. So the semi-quantitative is just the reagent strip test.
Oh, okay. So it's the performance of the test. Pretty
Yeah.
much.
All right. So
Right.
the second one, sodium. Do you want to just try and do those on your own and then email me for the answers?
Sure. I got one.
You did them? Okay.
First one was wrong.
Okay.
That's the one. Doesn't matter.
All right.
So you just saw that. So
And that should be in the back of the book anyway, right? It's an odd number.
Right. Right. All right, number 10. 83735, 83540, 84100, 84155, diagnoses 586, 285.9, and 401.9. Number 11, 80076, 80061, diagnosis 272.4. 12, 80198, diagnosis 493.90. 13, 80162, and diagnosis 427.31. Report number 14, report 54, 88305, with diagnosis 198.82 and 199.1. Number 16, report 56, 88305 times 3, with diagnosis 211.3. 18, 88305 times 2, diagnosis 211.3 and 530.85. 20, 88304, diagnosis 214.8. 22, 88305, diagnosis 707.04, 707.20. Number 24, 88304, diagnosis 704.41. 26, 88104, diagnosis 518.0. All right, move on to chapter 30. It was a long one. Again, I'm not going to read the numbers. I'll just start with 1. M, J, H, D, N, F, I, C, G, B, L, K, A, E, G, D, F, E, A, B, C. 22. Vibrating or moving at certain frequencies. 23. Hearing test. 24. Procedure for evaluating middle ear disorders. 25. Stimulation of the cochlea to measure electrical activity. 26. Corrective or in the correct place. 27. Studying the capillaries of the eyes. 28. Measurement of the retina to the stimulation of light. 29. A device for detecting color blindness. 30. Absence of the lens of the eye. 31. Cornea and sclera together forming one organ. 32. Transparent front window of the eye that serves as the major refractive surface. And 33. The thick outer coat of the eye, mostly white and opaque. Practical, starting with 34. Nine 95125. 35 95052 times 2. 36 92326. 37 92341. 38 92270. 39 92534. 40 92542. 41 91034. 42 90947. 43 90880, 44 91030, 45 92626, 46 90846, 47 90940, 48 92553, 49 93503, 50 93282 with diagnosis 427.81, 51 94003, diagnosis 518.81, 52 97761 times 3, 53 99144, 54 91110, 55 90471 with 90472, 56 99233, diagnoses 421.0 and 427.42, 57 diagnoses 410.21 and 429.71, 58 diagnosis 440.21. Under the reports, number 60, 77056, diagnosis 611.72. 62 is none because scheduling calls are not billable. 64, 19120 with a modifier 59. And the reason is because the excision of the mass was performed prior to the mastectomy. So the physician had to wait for the results of the biopsy, basically, to determine what he was going to do further. 66, 99251, 68, 34201, modifier 50, and 70, 99024, diagnoses V58.42. All right, so just a reminder, when you are doing the exams on Evolve, it will be multiple choice. So the pre-test, honestly and truly, is just about trying to figure out what are the correct answers as quickly as possible. So let's just say have I given you many multiple exams on Evolve? I mean multiple choices?
Yeah, they all are
Pretty much? Okay.
I think they all are.
So this is very similar, but you're going to have longer answers. So not just one procedure code, but like you had in these exercises, several procedure codes or several diagnoses. Okay, so I want you to be able to pick out the main terms and look at the codes real quick and say, all right, I'm going to look up, let's say, B and D and see if those match accurately or close. So right away, you should be able to tell, oh, D is not it. Okay, cross it out. Or, however you can do it. All right, so if B is close, then let's try A. Try to get rid of the two most incorrect answers as quickly as possible. Remember, you only have 2.5 minutes at most per exercise to get through 150 questions on the exam, okay? Don't try to do this to be perfect the first time, because when we come together for the review class, we're going to go through more exercises to help you with that, okay? The grades on the pre, post, and final exam do not make or break your passing this class, all right? Everyone pretty much with a 70% or above passes this class, okay? So not to worry. They are practice. They help me to see where you're at when you are done with this class, and then the exam review book helps to kind of wrangle you in to show you, okay, these are the areas you need to know for the exam, and then when we come together for the review, that's when we're going to give you the tips and tricks. The biggest thing about the national exam, and I can't stress it enough, is your time management. It's not about memorizing any of this information. It's about knowing where to find it in your book, which is why, we highlighted and underlined, and I gave you key words to look for in those sections. All right? That's why the tabbing, okay? The tabbing, the bubbling, all of that stuff. All right? Any questions? Angel, what's your takeaway from tonight?
There's a lot to it. Are we gonna have to do are we gonna do the 1,500 forms from beginning to end? Are they gonna give us an example of?
No, they're not.
Okay.
No.
There's a lot
Anything-
on that form.
Anything that you learned in the Fordney book will not be on the exam. Remember, having medical billing and coding in this class, what that is that it allows you to go out into the workforce and sell your services as a medical biller and coder. So everything you did practice in the Fordney book, that's what you need to know to present yourself as a biller. Okay? Filling out the 1,500 form, very rarely will you ever have to do that on paper. I think, well, number one, you're not going to do it by hand, because those people who do it by hand are your massage therapists, and maybe your, people who come and visit you at home to do PT. But there are very, 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 very few paper claims out there, and the paper claims that are sent are done in EMRs or billing programs. So you know already that you have to enter certain information into that EHR to spit out this claim form. So you're going to know how to do it, but know that it is a CMS 1500 form, not a HCFA. HCFA is what it used to be called. Okay? What's your takeaway, Emily?
I need to speed myself up. I get stuck when I know how to do it and I know how to look for the main terms, but I just need to work on getting a move on with it because I get too slow.
Okay.
I get stuck in it.
So when you're doing the review book, it's not going to be a lot of multiple choice, but there is some. Your answers will be in between every section. Okay? Time yourself.
Yeah, I have.
Have a little timer.
I tried with the workbook with this.
Okay.
Now, I just want to double check. You said we had the pre-exam that take it the week after. Is it the first half of the book?
Yes.
Okay. And then
So-
send you the results for the first one.
Right.
Then I
By
had,
April 2nd.
by March 22nd, 26th, you will take
Okay.
the pre-exam.
okay.
No studying, no book. So you actually have until the 26th to finish up your exams on Evolve, finish doing any practice work or stuff at the end of the chapters or in the workbook. Okay? Then from the 26th to April 2nd, that is when you'll be working on the exam review book. And then from April 2nd to April 9th, that's when you'll work on the rest of the exam review book, finish it up, and we'll come here for review. Okay?
And you're talking the physician's coding exam book when you said
Yes.
the exam book. Okay.
Yes, that red book, is it red?
Yeah, it's got a multicolor on the front there. Right.
I don't have one.
Okay.
I do have
All right. So then we're gonna come in for the exam on April 9th.
Well, we're going to do a review.
A review exam. Okay.
We're going to do a review of the pre and post exam.
Okay.
And then I'm working on scheduling the mock exam for sometime within the next 6 weeks.
Oh, the only week. Well, you wouldn't do it Memorial Day weekend.
No.
Anyways, but that's the only weekend I can't.
I'm not going to go any later than the middle of May.
Okay.
I'm trying to get it within the next 6 weeks.
Okay.
Okay?
Okay.
All right. You can reach me by email if you guys need me.
All right. Thank you.
All right. Thank you for joining me tonight. Have a good one.
You too.
Bye.